London Underground absence crisis, puțin high. Too high? What's the fix? Here's a question London needs to ask. Why is sickness absence on the Underground so high? And is it different to the UK average? And when absence is high, how should we respond? With draconian tracking or empathy? Let's break it down. In 2024, the UK's average sickness absence rate was around 2.0% of working hours. In public sector work, that number rises, about 2.9% for public sector employees. But for London Underground/TfL, the story is more complex. We don't always get clean published tube-only absence rates by role, but we do see signs of significant long-term sickness. Data from TF. Maisa shows many employees in bands of 60 to 120 days, or 121 to 365 days off. Transport for London. Also, exposure risks are real. Tube workers, especially drivers, deal with indoor dust/PM 2.5 levels far above outdoor ambient levels. That exposure correlates with higher absenteeism in some lines. British Safety Council. So yes, the absence burden seems higher, more volatile, and loaded with structural causes that aren't always seen in a typical office environment. Let's not pretend it's just laziness. There are real factors. Health and environment. Underground air is dusty, tunnels confine polluted air. Many staff have chronic exposure. Physical strain, station staff, maintenance, escalators, stairs, jobs that take a physical toll. Psychosocial stress, shift work, night work, mental health pressures, structural absence rules, variations in sick pay, attendance policies, protections. TfL's policies differ across parts of the organisation. Transport for London, but still Finad. When absence climbs this high, it's breaking the system. Timetables break, staff have to cover, safety margins shrink. How should we manage attendance? Now we reach the contentious fork. Do we build a specialist attendance department with surveillance, tracking, strict rules? Or lean into care, support, rehabilitation? Or should attendance remain with local management? The frontline supervisors who know their teams but may lack objectivity. Option A. Draconian centralised approach, real-time surveillance, biometric validation, audit trails, strict thresholds and penalties. Pros: clarity, consistency, deterrence. Cons: resentment, fear, union backlash, chilling effect on genuine illness. Option B. Empathetic specialist unit, support teams, occupational health, return to work coaching, mental health wraparound. Early intervention, flexible plans, case management. Pros: trust, retention, addressing root causes. Cons: resource, slower results, possible exploitation. Option C. Local management remains in control. Supervisors know individual context. Pros: people understand their teams. Cons: bias, favoritism, weak enforcement, risk of local cover-up. And let's be frank, unions are in this too. Some argue unions protect underperformance, stand behind staff with weak attendance, and make pushing accountability difficult. But unions would say they're protecting workers from unfair monitoring or punitive culture. Where's the line? So, what do you want to see on the tube? A draconian attendance machine, a caring support hub, or empowered local leadership, or something hybrid? And are our unions helping or hurting real accountability? Drop your view in the comments. Share this if you want attendance reform in transport, not just excuses. And if you've ever covered someone else's shift because of absence, think about it. Whose side are you on?